En esta primera exposición, denominada Un enfoque integral para la asistencia en salud mental adolescente, contaremos con la participación de una experiencia australiana denominada Headpsace. Es una estrategia integral de asistencia en salud mental adolescente, llevada adelante por la Fundación Nacional de Salud Mental Adolescente de Australia, sustentada con fondos del gobierno australiano. Tiene ya más de 10 años de historia, más de 150 centros alrededor del país, atención en línea y telefónica a las 24 horas, la atención en salud mental integra el apoyo educativo, además, la salud física y sexual, el consumo de alcohol y también de drogas. Un componente fundamental es la participación de los jóvenes en la planificación y toma de decisiones. La presentación estará a cargo de Samuel Irving, que es doctor en psicología por la Universidad de Nottingham y máster en neurociencias por la Universidad de Manchester. Trabajó durante 7 años en Headpsace, incluye la articulación del modelo Headpsace en todas sus áreas. Le agradecemos y le damos la bienvenida a Samuel.
Thank you very much for the invitation to speak and to attend your event today. I'm really looking forward to the conversations that we have over the next couple of days around youth mental health, and I hope that the experiences that we've had in Australia over the past 15 years can be of some benefit to the planning on how things evolve here in Uruguay. So Headspace is the National Youth Mental Health Organisation Foundation of Australia. We work with 12 to 25-year-olds across the country. We are funded by the Department of Health in Australia. It's customary to acknowledge the traditional owners of the lands that Headspace works upon, and so I'll just do that now before I start any further into my talk. So Headspace acknowledges Aboriginal and Torres Strait Islander peoples as Australia's first people and traditional custodians. We value their cultures, identities, and continuing connection to culture, waters, kin, and community. We pay our respects to elders past and present and are committed to making a positive contribution to the well-being of Aboriginal and Torres Strait Islander young people by providing services that are welcoming, safe, culturally appropriate, and inclusive. And on a personal level, I acknowledge the Wurundjeri people of the Kulin Nation as the traditional owners of the lands that I live and work upon in Melbourne. So here's what I'm going to talk about today. I've got quite a lot to squeeze into half an hour, so hopefully we'll get through it in a meaningful way, and I'll bring you along for the ride. So I'm just going to quickly talk about the Australian context, about why and how Headspace came to be, the importance of the young, including young people and their voice in our work. And then I'll talk about really what our initiatives are. So they come across in 4 main pillars: our Headspace Centre network, our clinics, if you like, our digital mental health programs, our work and study programs, our Headspace schools and community program, and then also quickly touch on how this is all coordinated at a national level by Headspace National, which is where I work. So, the Australian context. The population of Australia is around 26 million at the last census, which was earlier this year. Size, I'm sure you're all aware, Australia is a very large country. Here I've overlaid Australia onto the map of where we are currently. I've put Melbourne, where I live, on top of Montevideo, just so that I feel at home here. I already feel very welcome. And conversely, Uruguay here overlaid into Australia, just to really give you an idea of the scale of the size of the country, which has its own challenges, as I'm sure you can understand. With increased size comes diversity. So diversity of cultural background, of location, and of access to health services. Australia is a country made up of immigrants. We have a wide and diverse network of population with different needs and different cultural backgrounds, as well as our First Nations people. As you can see from this density map here, the majority of the population of Australia lives along the east and southeast coasts, with a little hub over in Western Australia by Perth. The grey on here says no population. I think that's a little bit harsh. There are many people living in those areas, but definitely a lot of those communities are remote or very remote and have really minimal access to healthcare services. I don't think you can do a talk about Australia without mentioning our furry friends. So we have koalas, we have beautiful beaches, we have kangaroos. Sometimes we have kangaroos on beautiful beaches for that full Australian effect, as here. And also some of our animals are not quite so cuddly, and they will do what they can to bite, sting, maim, or otherwise cause you pain, including this is a blue bottle jellyfish, a tiger snake here in the top right, saltwater crocodiles, obviously very large. And this redback spider was living in my letterbox for a little while until very recently when I removed it. Oh, sorry. There you go. Well, there's the kangaroos again. There you are. Makes a lot more sense when you can actually see my slides. There you go. And here we go. Deadly and painful animals. Thank you for letting me know. So in terms of geopolitically, Australia is governed by a range of states and divided into states and territories. With the capital being Canberra, where the federal government is based. Headpsace is an initiative of the federal or Commonwealth government of Australia, and that's who our funding body is. So we like to call Headpsace Australia's innovation in youth mental health care. Our vision is that all young Australians are supported to be mentally healthy and engaged in their communities. Our desired impact is that young people can access the right support when they want it and how they want it, be that through face-to-face services, online, through the phone, or however they want to access the care, and whenever they want, we want to be able to provide it to them. Essentially, Headpsace is an enhanced primary health platform for 12 to 25-year-old young people. In order to provide holistic care, we recognise that young people and their well-being is a product of their biopsychosocial factors. And therefore, we approach our services along 4 core streams of mental health, physical and sexual health, alcohol and other drug use, and work and study. We have a role in promoting mental health literacy, reducing stigma around mental health and mental ill health, and encouraging help seeking. We also have a role in advocating to support the youth mental health system change. There's been a lot of change in Australia in the mental health system over the last 15 years, but we still have a lot of work to do before it works in a way that's going to work for all young people. And crucially, and I will keep coming back to this, young people and their families are at the heart of everything that we do. So why Headpsace? Well, back in 2004, our government had commissioned an inquiry into mental health, which unsurprisingly for the time perhaps found that mental health was often neglected and was associated with high levels of stigma in the population. We also know, and as Rachel mentioned this morning, that 75% of mental health issues emerge before people reach the age of 25. And in Australia, unfortunately, back then and still to this day, suicide is the primary cause of death in people aged 14 to 44, which is, I think, unacceptable. The burden of disease in young people is highly skewed towards mental health. So in older populations, obviously, you expect to see more physical health challenges. Young people tend to be pretty physically healthy. So really the issues that we see with these populations are around their mental health. And despite this, their help-seeking rates were extremely low. So Headpsace has a key role in recognising and minimising these barriers to help seeking. So we know that some of the barriers, for example, may be around cost, around low mental health literacy. They're just not aware that something that they might be experiencing is a mental health challenge. They're highly stigmatised again, and there are a whole raft of other reasons which may stop or be a barrier to a young person seeking support. And we actively try to go against these barriers to increase a young person's access to healthcare. Our primary aim is to provide early identification and early intervention of mental health issues. And again, as was spoken about this morning, this is to to minimize the effects in when the person is still a young person, and then also this will have a flow-on effect for the rest of their life. So we want to get in there early, and we want to give them a good experience. Again, we want to provide that. We want to make sure that the first experience of engaging with the healthcare system is positive. We know that if a young person, or indeed anybody, has a negative first experience of coming to a healthcare setting, that they are less likely to re-engage later on in life. So we see that we have a critical role in making sure that that first experience is positive, even if it's only a very short experience. Again, we put young people at the center of service development. Young people tell us how they want our services to work, and we listen to them. And because of the diversity that we have across the country, we have a nationally consistent approach, which is Headpsace. But every community will implement Headpsace in a locally responsive way to meet the needs of that community. So one of our young people called Headpsace a national recipe with local ingredients, which we kind of liked. And very importantly, one of the factors that's really made Headpsace successful is that we've had support from all sides of the political sphere across Australia since its inception in 2004. So everybody is confident that Headpsace is around, that it's a trusted brand, a trusted service, and they want to keep funding us. So this is what our network currently looks like of our centres. There are over 153 Headpsace services across the country. You can see they kind of align with the map that I showed earlier around where the populations are. The services themselves that each centre differ in their size, in how rural they are, in the community needs, and in their governing agencies. And again, nationally consistent, locally responsive. So I've mentioned it a few times already. This really is the heart of what we do. And it was really fantastic to see the panel of young people speaking in this morning's session. Headpsace is definitely youth-led. I can't emphasize this enough. The saying, nothing about us without us, comes to mind. We definitely go out of our way to implement this. This picture is an image of High Energy, which is our Headpsace Youth National Reference Group. We love an acronym at Headpsace. Every time we can make an acronym, we will, apparently. But essentially, this is a group of 20 young people from across the country. They have diverse needs. They come from diverse backgrounds and diverse communities, and they provide input into all of our operations at Headpsace on a national level. But young people are also involved at every step of the Headpsace journey. So it's not just at Headpsace National with those 20 individuals. We also have young people at the centres. Every centre has its own youth reference group, a group of between maybe 5 to 20 young people from within that community who help their Headpsace centre to provide services that meet the needs of the young people within that community. All of our initiatives are established with advisory groups, and they always include the voice of young people. I've already mentioned High Energy, which is our national youth reference group. And we also have youth representation at the highest level of our organisation on the executive and at our board level. So really, the youth voice is critical to how Headpsace operates. And it's because of this, I think, that we have been so successful. Gone the wrong way. And again, recognising the importance of family in a young person's life and well-being, we are emulating these structures currently, increasingly with family members and their friends, who are people that have supported a young person through a mental health challenge, either through Headpsace or elsewhere. So this is a video that was created telling the story. We believe that young people's stories are important and they are very powerful. back in 2019, early 2020, unfortunately, the eastern coast of Australia had a very large number of bushfires, which impacted a lot of communities, and many houses were lost. And obviously, a lot of those communities were serviced by Headpsace Centre. So after that event, we created this video with members of the local youth reference group from Headspace Bega, which is in that community. And if somebody's happy to start the video, then we can just watch Heidi's story, and you can stop listening to me for a moment.
My name is Heidi, and this is my story. I grew up in Lochiel, living on a small acreage. I live there with my mum now, and it's really peaceful. Every morning I kind of sit out on the veranda and just embrace everything of a morning before I think about going to my day and doing everything like that. And I think it's just a part of me, I guess, something that I have to do. Just sit there and listen to peaceful, and yeah. So the first fire started, it was about 8 k's away from us. We kind of just smelt the smoke at home, saw it drifting a little bit, got the alert on the app, and within an hour it escalated to emergency warning. The sun started to turn orange, and we started packing everything up from home, and that's something we hadn't even planned it yet. And yeah, we evacuated in town. Yeah, and that was one of like 4 or 5 evacuations that we did. We got told later on that the fire at Chalk Hills was, they were waiting for the wind to change, and it would have swept right through the gully and right through our place, and everything would have been gone. So we're really lucky. And I don't know what I would have done if we lost everything, because I've always lived there, and it's a property that my parents bought from their parents, so it's always been in the family. Usually my big support is my music, and it always has been, you know, being surrounded by a lot of grief and other forms of just like strong events in my life. Music has always been there for me, and also connects me a lot to my brother and my dad, because they both did heavily like music. And also just me being connected with Headspace in their youth reference group beforehand, I've learnt a lot of things, and it's just been a really great experience, and I'm glad that I made that connection. And just having different experiences and me myself, it gave me, like, it's helping me just know that what I'm feeling is fine, and be able to share that, and uplifting other people to be able to like reduce the stigma of mental health is a big thing. Yeah. What gives me hope is that I've been through this process before, and now I have more time to prepare, and I have connections like with Headspace and other agencies and other people that I can talk to and help to get prepared for the new season.
And again, in the video, if we get it to play, one of the things, you know, we know that young people like to hear from other young people that have had similar experiences as them. They like to hear how other young people have coped in those situations, and hearing it directly from a young person who has been through that already is hugely beneficial to the young people that are experiencing that, who might be reluctant to seek help, and may think that actually what they're experiencing isn't normal. Certainly, if you've been through the trauma of a bushfire, it's very normal to have to feel not okay, and these videos are there to help to normalise those experiences. So, talking about our Headspace programs, again, youth-led, they are basically organised these days. We've grown a lot since we first were established back in 2005-06. Around that time, which was where initially we were mainly just the Headspace services. Now we have a different a suite of offerings that work in an integrated way to support accessible in-person, online, and over the phone support for young people. So we have our centres network, which is the face-to-face services. We have our centres, they deliver outreach, and we have a specific early psychosis program as well. We also have digital mental health programs, including Headpsace, which is our online counselling service, and I'll talk to that a little bit more in a moment. We have a telepsychiatry program for those young people who need access to psychiatry that live in rural and remote areas where there is no access to psychiatrists, as well as other initiatives through our website, which young people can access when and where they need it. Our work and study programs operate out of Headspace services. So we've been delivering the work and study in centres, the IPS, the Individual Placement and Support Program, which is an American initiative that we are implementing within our Headspace services. We've been doing that for the past 5 years. And we also have our online work and study with online support and career mentoring programs. And then finally, our Headspace Schools and Communities program, which have a role in providing mental health literacy to schools and communities, as well as providing suicide postvention support. So where there is a death by suicide of a young person in a school community, we will fly out and support the community to recover from that death. And increasingly, unfortunately, that team also is operating around natural disasters, of which there have been, unfortunately, many in the last few years in Australia. So before I go any further, does any of it work? This is a timely conversation. Only 2 weeks ago, the federal government released their independent evaluation of our Headspace services, which I'm happy to say found that they were cost effective. They're well designed and appropriate to meet the needs of and objectives. They provide a comprehensive, appropriate and complete number of components that really address the needs of mild to moderate high prevalence conditions such as anxiety and depression, and really those are that kind of high prevalence mild to moderate conditions are what Headspace is primarily funded to address. We've grown to scale with increasing populations, and we successfully support the participation of young people in their own care, which is something that we strive to do, as I've already mentioned. In terms of impacts on mental health and psychosocial outcomes, the independent evaluation found that it supports intermediate measures for the general population of young people, including mental health literacy, early help seeking, and stigma reduction as well, and it also saw value in our advocacy and promotion activities. So we were very pleased to see positive evaluation of our work, obviously, but you know these quotes as well go a long way to make us feel good about the work that we're doing. This is a quote from a young person that was interviewed during the process. I think it's solely because of Headspace that I got better. I wouldn't ever have gotten better if I hadn't gone. So I don't think it gets much more black and white, to be honest, in terms of hearing a young person tell us that those are the reasons for their improvements. So our centres network. So as I've mentioned, currently 153 services. We're going up to 170 by 2024, which is a huge growth really from when we first began. Every Headspace service is a partnership with the community. Often the communities, a Headspace centre comes to be through advocacy from the community who identify that really they want to have a Headspace centre in their community to help their local young people. It's a good day for the ministers when they're able to announce that Headspace service is being opened. That's a big tick from the electorate, which makes them very popular. The Headspace service partners with the existing services within the community to establish. So they work with the tertiary mental health services, they work with the local schools, they work with the local pre-existing alcohol and other drug services. And really, if you think of Headspace as a portal to access the healthcare service, if the Headspace doesn't have all of the doesn't have all of the care requirements of the young person. They know they're embedded within the community and can get the young person the care that they need through there. Here's our national recipe, the Headspace Centre model. It's composed of 16 components, 10 of which are the service level components. You can see young people at the centre of everything that we do and around the outside. The blue components here, there are 6 of these. These are the facilitating components, which are the ones that make the service components possible. This has been published, so you can the reference is on the screen here. I'm not going to have time, unfortunately, to go into much more detail on this, but it can be part of our conversations over the next couple of days, certainly. Every Headspace service is assessed against how they operate, how their local ingredients are making the national recipe. And Headspace National has a role in assessing every Headspace centre across the country to make sure they are delivering care in line with the Headspace model and ensuring that they are providing safe and quality care for young people and their families. So within each centre, the workforce is diverse as well. It really depends on the needs of that community as well as access to workforce. Every centre clearly has management, a clinical lead who holds the clinical governance of the centre, admin and reception staff, and a critical role from the community awareness workers who have a role in promoting mental health literacy and help seeking within their local community. We also clearly have mental health professionals, be they psychologists, social workers, occupational therapists who work within the centre, general practitioners, so that's doctors, to help with the physical health of young people so they receive the care in a holistic way, and a whole bunch of other role types that can be employed within a Headspace centre to make sure that it is operating in a way that meets the needs of that local community. Headspace centres themselves, they are clinics, if you like, but we don't call them clinics because they are youthful, colourful, funky. Often might have a PlayStation in there. They've bean bags. They're designed by the youth reference group. So again, young people tell us a place that will make them feel welcoming, and that is what we go out of our way to ensure is what happens. I have another video here, but I don't know whether. Oh, we're going to try. Nicholas tells me we're going to try. This is a shorter one.
When I first came to Headspace, I walked in, was greeted with a smile at reception. They gave me an iPad to fill out some more information, and then I waited in reception until someone came to find out how I could get help.
The first appointment that we book in is sort of an hour for you to get to know Headspace and us to get to know you and all the things that are going on in your life and how we might be able to best support you.
What it's like at Headspace is that it is quite different from going to a GP or a medical centre or sort of going into hospital and talking to the mental health team there.
Being at a Headspace centre it's warm, it's inclusive, it's welcoming, it's full of positive energy. They treat you like an individual, they don't treat you like a number.
We all offer mental health support, physical health support through like a GP, drug and alcohol support, and support with vocational work, so getting a job.
Okay, so hopefully through that you were able to have a look around a bit of a centre in the background there. You can see it's pretty colourful, lots of graphics, lots of posters. The green is very prevalent across Headspace. Our brand is very strong. You have to like green if you work at Headspace. And really the words, I think the key words that those young people were saying were, it was warm, it was accessible, I felt like a person. And those are really things that drive the work that we do at Headspace. Young people's voices and their identities are heard. So in terms of the growth of our network, this is just a plot that shows how the number of centres. That in red here we have centres that have been announced to be opened, and in green is how many centres actually opened in that time period. You can see that initially in 2007 we had 10 announced and we had 4 open services, whereas now we are up at 153. Since 2006, over 780,000 young people have accessed Headspace through over 4.5 million services, these are numbers that we're very proud of, but mainly because they show help seeking, which is really what we want. But we're also proud of the quality of each one of those occasions of service, because there's no point in just having people accessing services if they're not evidence-based and of a good quality. So in the last year alone, we provided nearly 407,000 occasions of service to young people across the country. So clearly, Headspace centres, with 153 centres, we can't be everywhere. We can't provide access to everybody face to face. So we have a suite of digital mental health programs as well. These can, at the most basic level of these, can be accessed through the Headspace website, which has a bunch of resources, fact sheets, evidence summaries, that kind of thing for young people if they just want some basic mental health literacy information. But the magic happens really when they create a username for themselves. This can be completely anonymous. They don't have to give us any details about themselves if they don't want to. And once they're in the Headspace account, they have access to more interactive resources, group chats, so young people that are going through a similar thing to them, which are moderated clearly with clinical oversight. We have online communities where young people can connect and feel part of something if they want to. And if they're not getting what they need through that self-directed approach, they can access one-on-one support directly through the Headspace platform into eHeadspace, which is our digital mental health service, which has got specially trained mental health clinicians, so psychologists, social workers, and occupational therapists working on the phone, on web chat, via email, via text message, however the young person wants to connect with them. And this is entirely free. It's anonymous. It's open every single day of the year, including Christmas Day, from 9 in the morning till 1 o'clock in the morning. And typically we see the peaks around in the evening, 7 till 11 o'clock is when young people tend to really want to access our services. And again, you can see numbers here about how many young people access this service. I know that I'm nearly out of time, so I'll speed through here. Our work and study programs, as I mentioned before, we have a program in centres where we're implementing the individual placement and support program, the IPS program, but we also have online support for young people that need help getting into work or getting back into work and study. These are one-on-one online vocational support with a careers specialist for young people aged 15 to 25. And this support is provided for 3 months, and hopefully they'll have a result before then, and typically they do. And this can be around helping them to identify what career they might like, what study they might like to do, helping prepare their resume, their CV, giving them interview preparation. So really it's a holistic suite of offerings to get a young person into a job or into education. These are also via web chat, phone or video calls, and they come with an integrated team of clinical staff as well to make sure that the young people, if they need any further support, have access to it. And then finally, our Headspace schools and communities programs have a role in building the mental health literacy and skills in schools and communities. So they support communities that have been impacted by the death of a young person by suicide or natural disasters. A newer program is the Mental Health in Education program, which is a program which is providing mental health literacy to young people in a secondary school setting, so high school. And then a broader initiative is the BU program, which is funded by the Department of Education. Headspace doesn't run this program, we're delivery partners of it, which is a program that works to provide mental health literacy information to educators. So this works from preschool years, so kindergartens, from primary all the way up to the end of high school. And again, this promotes skills and strategies to support mental health of children, young people and their staff. So really still equip teachers with mental health literacy to recognise changes in young people so that they can encourage them to seek support early at the onset of a mental health issue. Obviously, all of these programs take some coordination, and there seems to be more programs all the time, which is a good thing because it's what young people tell us that they need. So Headspace National, where I work, has oversight of these programs. We have a key role in evaluation and monitoring. So we collect data on every occasion of service that's provided through Headspace and the young people and the service providers that provide those occasions of service. We undertake research. We make evidence-based resources for young people, families, and professionals. I'm nearly finished. Crucially, we own the brand. Headspace has got a very, very strong brand. We know that 75% of young people recognize Headspace as a place that they can go to get support for their mental health, which my strategic comms team tells me is a very high number. So we're very proud of that. And we also have a role in national campaigns that go out via the TV, on bus stops, on buses. And here's an example of a few of those, again, to reduce stigma and promote help seeking in young people and conversations about mental health. And finally, just in summary, so Headspace is an enhanced primary care platform for young people aged 12 to 25. We are youth-led. We operate across 4 core streams of mental health, physical and sexual health, alcohol and other drugs, and work and study. We provide support when, where, and how it is wanted through our centres network, our digital mental health programs, our work and study programs, and our schools and community program. We're youth-led. Young people are at the heart of everything that we do. We have a very strong brand, which is led by young people and their voice. We do mental health campaigns. We provide evidence support practice. We're embedded in the communities, and we partner with the existing services within those communities. And just in case the message hadn't gone in, we are youth-led. Thank you for your time.